We're now on the record. Here begins the deposition of Ansel Glenn Anderson, MD. Today's date is May 18th, 2021. Time on the video monitor is 10:03 a.m. Would the court reporter please swear in the witness?
Okay, if you raise your right hand, please. Do you swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Would you state your full name, please, sir?
It's Ansel Glenn Anderson III.
And you a medical doctor?
Yes.
Dr. Anderson, I'm taking your deposition today to find out what I can about your care and treatment of Kay Anderson at St. Thomas West. And I want you to presume that this testimony would be as if the jury's looking at the camera here. So this will be my sole opportunity to find out what you know about the care. I'll be asking you for some medical opinions today. Will you agree to give those opinions to a reasonable degree of medical certainty?
As best I can.
All right. And if you don't mind, just take a little time and tell the jury a little bit about your medical background. Start with where you went to medical school and walk us forward.
So I went to medical school at the University of Mississippi. I did a residency in emergency medicine at University of Mississippi. After that, I spent a couple of years at the university on staff there, and then have worked several hospitals after that, including some hospital in Georgia and Birmingham, and I've been at St. Thomas West for the past 15 years.
All right. And what is your role at St. Thomas West Hospital?
I'm an emergency physician on staff.
And have you been working in the emergency department for the 15-year period?
Yes.
All right. All right. I've handed you, doctor, some documents which have been pre-marked for your convenience of the ER visit pertaining to Catherine E. Anderson. Do you have those records in front of you?
I do.
Okay. And I want to focus your attention now to May the 12th, 2020, and in particular when Miss Anderson came to St. Thomas West Hospital to the emergency department. Does this record contain some of your notations about your care and treatment of her?
Yes.
All right. And what is the process at the emergency room for how the care starts? And to give you a little idea where I'm going with this, does the nurse see Miss Anderson first and then you see her? How does that typically work?
Yeah, typically, and it depends on whether they come in by ambulance or whether they come in, just through the front door. But typically the nurse or one of the PAs will see the patient and have a initial triage.
All right. And in this case, did Miss Anderson arrive by ambulance or was she a walk-in?
I do not remember.
All right. Tell me what you know about the history that was obtained from Miss Anderson about why she was there.
She fell and had some injuries, and that's why she came in.
All right. And do you recall what those injuries were?
Based on my notes, what I can recall is that she had some facial injuries, and I think she complained of some shoulder and knee pain.
All right. And did you examine Miss Anderson?
Yes.
And as in the course of that examination, did you order some imaging studies?
I did.
All right. And what imaging studies did you order for her?
Well, I ordered, I'm going to have to go back and look,
Sure.
but I did order a CT scan of the head, a maxillofacial CT, X-rays of the right knee, and X-rays of the right shoulder.
All right. Let's take each of those imaging studies in any order you wish. I'm looking at page 19, which has the orders involving the X-ray of the knee.
Mm-hmm.
And again, these are just orders here, but can you tell from reading these? Well, I'm sorry. Go to page 25. That's where the findings are. I guess this is a better place to start. This involves the CT of the facial bones without contrast. Do you see that?
Yes.
All right. Will you briefly describe for the jury what is a CT scan?
CT scan is a form of digital imaging of the of whatever object, whatever body part that you're looking at. In this case, the facial bones. It's designed. This particular study is designed to look at the bones themselves.
All right. And it was noted to be without contrast. What does that mean?
That means that we didn't give IV contrast to, IV contrast is often used to enhance, a certain part that we need to see. And sometimes it's vascular, sometimes it's soft tissue, and in this case, we're looking at bones. So we did not need IV contrast to look at bones.
All right. Is this imaging study, is it done inside the emergency room?
Sometimes. We have a CT scanner that is just on the edge of the emergency department, and sometimes they go down the hall to our main imaging department, so I can't tell you where this one was done.
All right. And is it your customer practice to refer patients to the radiologist at the hospital to do this imaging?
Our radiologists read all the images that we do.
All right. And I assume that you await the results of those imaging studies before you come to a final diagnosis. Is that right? Okay. If you don't mind, doctor, can you explain to the jury what did the imaging study, the CT scan of the facial bones reveal?
So there's a nasal bone fracture. The radiologist notes also a right orbital floor fracture and a right lateral orbital wall fracture. There's some fluid and gas in the maxillary sinus, and then there's a lot of soft tissue swelling on top of that.
All right, let me, don't mind here just a moment. Can you use this just to orient the jury as to where these fractures are being detected on CT scan?
Okay, so this is the orbit. This is the right side, so it would be the orbital floor, which is here.
Okay.
The maxillary sinus is a space in between here. It's just in between here. So this is the maxillary sinus in that spot. You can't see it here, but the roof of the maxillary sinus is the orbital floor, and then the lateral wall of the sinus is here. The lateral wall of the orbit is here.
All right. And were those all the fractures that were detected on the CT scan?
Other than the nasal bone fracture.
All right.
Which is
All right.
minimal nasal bone fracture.
Doctor, if you go to the next page, there was a CT scan of the head without contrast.
Correct.
Is this a different scan than the scan that we were just talking about?
It images mainly the intracranial tissue, the brain, looking for, particularly in this case, for blood, if there's a subdural or epidural, a fracture of the cranium, or a bruise to the brain, something like that. But it's meant to image the brain for the most part.
All right. And what did the imaging study reveal?
There were not any intracranial findings, but it did show the orbital findings that we mentioned before.
All right. If you'll go to page 27, the next page over, let's talk about the Diagnostic X-Ray. It appears there was a X-ray of the knee, 3 views, the right knee?
Yes.
All right. And can you, I'm sure the jury knows what an X-ray is, can you tell the jury what those findings were?
So it's an X-ray of the right knee that did not show any fracture or any foreign body.
All right. And then the next test was an X-ray of the shoulder, right shoulder, 3 views. Do you see that?
Yes.
Okay. And what were the results of that imaging study?
No fractures or dislocation were seen.
All right. And I believe, is that all the imaging studies that were done?
I think that's it.
Okay. Doctor, was Miss Anderson in pain when she saw you in the emergency department?
So, because it's a year ago, I mean, I'm not I can't speak to everything that was going on at the moment, and I don't remember the case completely. Okay.
Sure.
My presumption that would be that she would be in pain, but again, you're asking me to recall the event, and I don't have total recall of that. I'm sorry.
Understand. Is there anything here in the chart that would help us on that matter? Like, was there any prescription that you gave to her for pain relief, anything like that?
Yes. I have to pull my note back here. And I did give her a prescription for an antibiotic and a pain medicine.
All right. There is a description on page 11, which is, and I don't know if is this your note or someone else's note. Can
That's
you tell?
my note.
Okay. You mentioned that there was ecchymosis over the nasal bridge with an abrasion over the nasal bridge as well. What is ecchymosis?
Bruising.
All right. And then you also know there was linear ecchymosis across the malar area on the right, extending over the lower ear. Where is that?
So that would be here in this area right here,
Right.
on the right side, of course. On the side.
All right. Doctor, I'm going to hand you some pictures and just ask you to go, you can just kind of thumb through those pictures and I want to see if, or I have a couple of questions about them.
Okay. Okay.
Doctor, are those pictures consistent with the injuries and findings that you noted in your emergency department record?
I'm just going to object to the foundation of these pictures in terms of the timing of when they were taken versus when the patient was actually seen in the emergency room.
Okay. Subject to that objection, are those injuries consistent with the findings that you made in the emergency department record for her?
Yes. She does have bruising over the nasal bridge and the bruising over the malar area. In looking at the bruising that's more around the mouth, a lot of times that's an after fact, and so I didn't note in my note that was there, the bruising along the lip and the chin.
All right. Let's make that the next exhibit, please. Collective exhibit.
Was the record the first one?
Yes.
Okay.
And doctor, did you have a formal diagnosis for Miss Anderson after you had reviewed the imaging studies and performed your examination?
Yes. The diagnosis was a acute right orbital floor fracture, acute right maxillary sinus lateral wall fracture, and an acute nasal fracture.
And doctor, what, in your opinion, was the cause of those fractures?
Well, by my recollection from the notes, she tripped and fell and struck her face.
Are those injuries consistent with a fall like that?
Yes.
Now, did you make some referrals for Miss Anderson to see some other healthcare providers after discharge?
I did.
Okay, and would you describe for the jury what those referrals were for and who she was supposed to see?
So I discussed the case with the nurse practitioner for Dr. Deborah Sherman. She's an oculoplastics doctor, and she will often help with fractures around the eye. And the main thing was to make sure that if there needed to be any intervention on the fractures, that I sent her to somebody who would be able to help her with that, or get her to somebody that would be able to help her, with that.
All right. Did you make another referral?
I don't remember making another referral.
I just want you to presume she went to Tennessee Orthopedic Alliance and was seen by a orthopedist there. Just check in here and see if you have any record of referring her
I
there.
don't remember making that referral.
Okay. Doctor, at this point, I think that's all the questions I have. Thank you.
Okay.
Doctor, I have just a few questions.
Okay.
And I know I introduced myself off the record, but once again, my name's Danielle Blauvelt. I represent the defendant, Dr. Wang, and Wang Vision Institute in this case. And just a point of clarification, are you employed by St. Thomas West Hospital?
No.
Who's your employer?
Middle Tennessee Emergency Physicians.
And has it been that case the entire 15 years you've worked at St. Thomas West Hospital?
No.
Was that the case when you were treating Miss Anderson in May 2020?
Yes.
How long have you been employed by, I'm sorry, you said Tennessee Emergency Middle?
So we underwent a merger with them in, I think in 2019. I could be wrong. It's 2019 or beginning of 2020.
Okay. Who was your employer previously?
We were called, I think, Emergency Physicians in Nashville. It was actually Nashville Emergency Medicine Consultants, I think is actually what it was called.
Okay.
It must have been 2019 that we went through that merger.
Okay. Do you cover any hospitals besides St. Thomas West?
No.
Okay. And it sounded like you had some independent recollection of your interaction with Miss Anderson. Is that correct?
I have very little, honestly. It's been a year, and my records, are what I mainly have to go by. It's a one-time visit. I didn't have any follow-up or any other interactions.
Is it safe to say that your testimony here today is primarily based upon your review of the records?
Yes.
Okay. Did you do anything other than reviewing your records to prepare for today's deposition?
No.
Okay. And when we're referring to the records, are we just referring to the notes you personally prepared in regards to the emergency room visit that Miss Anderson had?
And the CT scans.
And the CT scans?
And the imaging records, yep.
Okay. Would you have reviewed anything else, such as the triage notes or anything else in the records?
I did not.
Okay. The history that is in your note, where is that obtained from?
The history that's in my note?
Yes, in the ED records. I'm looking at, I'm looking at page 10 of our attached exhibit where it has the history of present illness.
Yep. So that would be from my interview with the patient when she came in.
So is this information that's provided to you by the patient?
Yes.
And are you relying on the patient to give you truthful and accurate information?
Yes.
Do you have any recollection as to whether you found Ms. Anderson to be a reliable historian?
You know, I don't know how to interpret that question, honestly.
Well, sometimes I see in provider notes that there is a statement to the effect of patient's a poor historian or patient's an unreliable historian. Would there have been
in that
anything?
respect, I would say that she was reliable.
Okay. So in the absence of any notation on your part that she was not a reliable historian, you believe you would have found her to be a reliable historian, is that
Yes.
correct? And I believe earlier you testified that she fell because of a trip and fall. Is that correct?
Yes.
Okay. And that's indicated here in that
In the
history
notes.
of present
In
illness?
the notes, yeah.
Okay. And that would have been information you obtained directly from the patient?
Yes.
Is there anything that you obtained from the patient that indicated that she fell due to a lack of depth perception?
I can't speak to that. That's not something I asked or addressed. No.
If she had reported that to you, would you have included that in your notes?
Perhaps if she had made that an important part of why she fell, but that was I didn't ask her that, and that information wasn't given to me, so I don't know that I can speak to that as directly. I don't have any knowledge of that.
Okay. But if the patient had reported to you that a lack of depth perception was a contributing factor to the fall, would that have been significant enough for you to have included in your notes?
Yes.
I'm just returning to page 25, which is the report of the maxillofacial CT scan. And under the findings section of the report, it refers to the fractures being mildly displaced. Can you explain the significance?
You're on page
Let me know when you
25.
get there. Should be page
Okay.
25. And I'm looking at the finding sections. It says mildly displaced fractures of the right nasal bone and the anterior mid portion of the nasal bones. What is the significance of the fracture being mildly displaced?
So the amount of displacement will determine what, a lot of times if things need to be adjusted to bring them back into position, normal anatomical position.
Okay. Is that what sometimes is referred to as setting of the bones?
Yeah, you could call it that. Yeah.
Okay. Did you have to do anything to Ms. Anderson's fractures in her face to bring them back into alignment?
So I don't normally do that. That's something I leave to a specialist to do. So I wouldn't have done that if they were very displaced or mildly displaced. Either way, it's just not part of my practice to reset facial bones.
Okay. And was that part of the purpose of referring her to Dr. Sherman?
Yes.
Okay. And you would have deferred to Dr. Sherman to determine whether anything needed to
Yes.
be done? Okay. And I believe you testified that you gave her a prescription for antibiotics and pain medicine. Is that correct?
That's correct.
What was the purpose of prescribing antibiotics?
So because she had an abrasion over the nose, and she also had obviously a fracture of the sinus because she had fluid in the sinus and had some air there in that area as well. anytime you have that, there can be some translocation of bacteria. You have bacteria in the nose and in the sinuses, and you don't want that to get into other places. If it does, you want to suppress any growth, and so the bacteria, the antibiotic is meant to do that.
Okay, is that a prophylactic measure then?
It is prophylactic, yeah.
Okay. The photographs that you were showing that we attached as an exhibit, these were not photographs taken in the emergency department, is that correct?
No, they were not taken in the emergency department.
Did you take any photographs in the emergency
I
department?
did not.
Okay. Do you know if any nurse or other staff of the hospital would have taken any photographs?
No.
As far as you're aware, her injuries were not visually documented in any way?
No.
Sorry, the problem going second is you have to jump all over the place. I apologize.
It's okay.
Are you aware of whether Ms. Anderson would have been mailed any information regarding your diagnosis or findings from the emergency department visit?
I'm not aware that would happen.
Would she have been given any materials at the time of the visit?
Yes.
And what would that have included?
I think I actually gave her copies of the CT reports for her to take with her.
Okay. And that would, I'm sorry, go ahead.
Yeah, I often do that so that they don't have to go through medical records and try to get things. They can just hand them to their doctor.
Okay. And that would be the same CT reports as we're seeing
It would
here
be
in
what
our
you have
exhibit?
there, yes.
Okay. I think you touched on this earlier, but just to clarify, did you speak with or follow up with Ms. Anderson at any point after her emergency department visit of May 12, 2020?
No, I didn't.
And have you spoken with any attorney involved in this matter prior to today's deposition?
No.
Are you planning on giving any opinions as to the cause of Ms. Anderson's fall, other than what you've stated here today in terms of it being a trip and fall?
That's all I know.
Okay. And so you don't have any intention, as you say here today, of offering any opinions beyond what you've already stated here today?
No.
And do you have any opinions related to Ms. Anderson's fall or her injuries from the fall that we haven't discussed here today?
I don't think so.
Okay. I don't have any further questions. Thank you.
We can do this off the record.
Okay. This marks the end of the deposition. Going off the record, time on the monitor is 10:31.